The Lagos State Ministry of Health invites you to a press briefing on the pathway to Malaria Pre-Elimination and Digitization Programme. This high-impact event aims to transform malaria control in Lagos State through innovative digital solutions, improved case management, and strengthened public-private partnerships in healthcare delivery. By leveraging technology and collaborative efforts, the program seeks to make significant strides in the fight against malaria. The press briefing will offer critical insights into the program's objectives, strategies, and expected outcomes. Additionally, the Health Commissioner will discuss how the Lagos State Health Insurance Scheme (LASMA) will contribute to the program's success, highlighting its cost-effectiveness and benefits. This initiative aligns with the National Malaria Elimination Programme's NMEP goal to reduce malaria burden to pre-elimination levels and ultimately achieve a malaria-free Nigeria.
Elimination and Digitization Programme in the state. The context of this speech will make things clearer as we proceed. Tomorrow at the Eco Hotel here in Lagos, Victoria Island. This pathway is graciously funded by the Impact Project. The Impact Project is part of Nigeria's strategy to improve child health survival for human capital development, and is designated to significantly reduce under 5 mortality by dramatically improving access to essential health services. The Impact Project aims to cut Nigeria's under 5 mortality rate from 107 to 79 per 1,000 live births by the year 2030. Lagos currently has an under 5 mortality of 59 per 1,000 live births, and will be looking to achieve an equivalent 25% reduction over the next few years. By accelerating malaria control and strengthening our health platform, Lagos State is aligning with the national and global agenda to enhance child survival and human capital development. Malaria in Lagos remains a persistent challenge. Malaria remains a significant public health issue in Lagos State, despite being or having a lower prevalence compared to other parts of Nigeria. Recent trends indicate that malaria prevalence in Lagos has been fluctuating under 3% for the past 10 years. This means that 3 out of every 100 Lagosians in community have malaria parasites in their blood. Very importantly, linking patients to health insurance schemes. Financial barriers often prevent patients from accessing timely and adequate health care. Many Lagosian residents pay out of pocket for malaria tests and treatment, which can discourage them from seeking care early and adhering to professional advice. To promote affordable access, this program is actively linking patients to social health insurance programs by a deep collaboration with LASMA, our insurance agency. In Lagos, schemes like Ilera Eco, the state health insurance, social health insurance, can cover malaria diagnosis and treatment services at little or no cost to the patient. By facilitating enrollment into these insurance schemes at the point of care in community, the program will reduce out-of-pocket expense for families and drive up the number of enrollees on our state health social insurance. These interventions are supported by cutting-edge digital tools. A central data system embedded in the new Lagos Smart Information Platform known as SHIP will collect information from all participating facilities, public hospitals, private clinics, and pharmacies, giving the Ministry of Health real-time information, a dashboard of malaria cases as they occur across the state. Very important are the collaborations that we are establishing. The pathway to pre-elimination for malaria exemplifies a collaborative multi-sector effort. It is being implemented by the Lagos State Ministry of Health in partnership with the international and national stakeholders. Key partners include the World Health Organization, which is providing strategic guidance and oversight, the National Malaria Elimination Programme of the Federal Ministry of Health, ensuring alignment with national malaria control strategies, the Pharmacy Council of Nigeria, PCN, which is crucial for regulating and integrating the private pharmacies. This public-private partnership approach means that all levels of healthcare systems are engaged, from community pharmacies on the front line up to international agencies. The launching will be a high-level event. To formally kick off the pathway to Malaria Pre-Elimination, a high-profile launch event will take place at Eko Hotel in Lagos tomorrow, the 4th of March, 2025. The event will be hosted by His Excellency, the Executive Governor of Lagos State, Mr. Babajide Sanwo-Olu, reflecting the government's top-level commitment to this cause. Prominent stakeholders from across the health sector and developmental partners will be in attendance, including the Honorable Minister for Health and Social Welfare of the Federal Republic of Nigeria, the Coordinating Minister of Health, Professor Mohammed Ali Pate, Dr. Isiaq Adekunle Salako, the Honorable Minister of State for Health of the Federal Republic of Nigeria, Dr. Ndiam Diop, the Country Director, Nigeria World Bank, representatives of the World Health Organization, Pharmacy Council of Nigeria, and the Nigeria Malaria Elimination Programme, amongst others, and key representatives of the National Forum of Health Commissioners. I would like to use this opportunity as a call to action. The Lagos State Government is calling on all stakeholders to support and participate in this bold initiative for the pathway to Malaria Pre-Elimination to succeed. The active involvement of everyone is required. Policymakers and donors continue to support and prioritize funding to malaria control and health systems strengthening. Investments in healthcare infrastructure, surveillance systems, and community programs are investments that have proven impact, such as programs to help expand successful interventions to all parts of the state. Healthcare professionals, from donors, doctors, and nurses in our hospitals, to pharmacists and healthcare workers in community, your role is pivotal. Embracing the training and digital tools being provided, ensure that every patient is tested, every confirmed case is treated according to national guidelines, and every case is reported through the proper channels. By adhering to the new standardized protocols, you become champions of quality care and lifesavers in your communities. We also call on private health providers to join this effort enthusiastically. Together, we can ensure that fever no longer automatically means malaria, and that every illness gets the correct diagnosis and the correct treatment that it deserves. Community leaders and citizens, your part in the fight against malaria is clear. Leaders at the community level can mobilize their people to clear stagnant water, keep their environments clean, and make sure families use mosquito nets when they go to sleep. Religious and traditional leaders, community-based organizations, and NGOs are encouraged to amplify awareness campaign messages. Malaria is preventable, malaria is treatable, and everyone has a role to end malaria in Lagos. For the general public, we urge you to sleep under mosquito nets, go for a test when you have a fever instead of self-medication, and complete the full course of treatment when diagnosed. Reject treatment without testing. By taking these actions, you protect yourself and others, and the environment. Every individual action contributes to a malaria-free Lagos in the near future. This program represents an historic opportunity to free Lagos from the grip of malaria. It is a collective journey towards a healthier, more productive, more economically viable society. As the launch unfolds, we look beyond the ceremony to the real hard work ahead, reaching every last community with life-saving interventions and paving the way for a malaria-free Lagos State. The Lagos State government invites all members of the media, developmental partners, and the public to join us at this monumental launch event and to follow the progress of this initiative closely. Together, we can drive malaria to zero in Lagos and foster a healthier future for generations to come. Thank you.
Thank you. It will be short. I think the Honorable Commissioner has basically stated it all. Changing behaviors in terms of it's no longer, I think I have malaria. That is what we're trying to eliminate here. I think I have malaria. And as the Commissioner has already said, a lot of people go, they self-diagnose or they ask their neighbors, and then they go to the pharmacist, then the pharmacist asks for their symptoms, and then they get whatever it is that they think that they have. So we want to eliminate, I think it's malaria. How do we eliminate it? Like the Honorable Commissioner said, by being treated, by being tested. So you go to the pharmacist, and there's been a lot of task shifting, a lot of training for the pharmacist that they will test you before they give you these malaria drugs. And a lot of people don't seem to realize that malaria drugs, you can actually become immune to the malaria drugs that we have. So if you really, really have malaria, and then we give you a malaria drug, you've had it, so you've taken the drug so many times that your body doesn't even react to it. So hopefully with this, and we do need everybody's attention, everybody's help, everybody is a stakeholder, every single person in this room. So if all of us have had malaria before, and I'm sure most of us were not tested. You just assumed you had malaria because the symptoms were malaria symptoms, but so were COVID symptoms. There are a lot of disease, situations where every single, even now, is pneumonia. Every single symptom you have is actually representing something else. And so we want to eliminate malaria so you do not have to take malaria drugs if you do not have malaria. So, and like she's also said, it's very important for people to know that, because I know you're probably going to ask how much is it going to cost and all that. But part of that is also encouraging people to take Ilerico. Not only do we have Ilerico, we also have Ecosha for those who are vulnerable or they cannot even afford it. So it's very important that people register for Ilerico or Ecosha, whichever one it is. I mean, Dr. Zamba is here, the PS for that department, and you can ask her, you can go to her organization to get more information. But other than that, look forward to seeing you all tomorrow where it will be launched, and thank you so much for coming.